Hey everyone, it's Riley here. I'm done my phone consultation with Dr. Belanger. Everything is good. I'm glad we had that conversation. I'm glad I was able to talk to her. I actually probably am going to go in for a in-person consultation as well in the near future. Not sure when yet. I'm still waiting on a response, but I feel comfortable with my decisions right now with surgery, with moving forward. I'm going to talk a little bit about the questions that I asked and just her responses. But, just moving forward, I don't know, like, it's just nice to be able to talk to her and get my worries out and be able to hear what she had to say, as well as just, like, talking about the possibilities of both and one she felt more comfortable with and all these things. So, I'm going to read my notes and questions and try and make this as brief and quick as possible, but as well giving you guys as much detail without trying to ramble too much. So at the end of this, I'm going to talk about where from here I'm going and my ultimate decision on surgery and what my choices are. So questions are for the revision, do they offer them? Yes. They try and do them through the stages. So if you have an example 3 stages, during your second and third stage, they would do the revision. If you need anything else after, they're more than willing to work with you on that. For complication rate, everything is covered, and when it comes down to it, I do have a doctor here that is looking after me. So once I come back from Montreal, I would have someone here. If there's anything that this doctor does not feel comfortable with, I do have Dr. Belanger in Montreal that I could always go back to. So that's also comforting to know, just to be able to have 2 people to rely on. With her experience with ALT and RFF, I did ask, which one was she more comfortable with? Well, currently, I have not done any ALT surgeries at the clinic yet. They are just starting to process them now. I know somebody was gone for, or is going for electrolysis on their leg, and they are going to be going through with ALT, but they have not actually, obviously, got to that stage yet. So right now, they have, in a way, 0 experience. She's done it and experienced it through her schooling and stuff, but when it comes to actually in the clinic, she hasn't done any. I just wanted to listen to the rest of what she had to say, but it definitely was worrisome. But with RFF, that's the surgery that they have always been known for, still do to this day, continue to do, and is most comfortable for them to be able to do. So in terms of the recovery and complications between the two, so with RFF, there's 2 to 3 stages, and with ALT, there's about 3 to 4. So the more surgeries you have, the more higher risk of complications. So right there, like your ALT, if you were to get it from your leg, is higher risk. The next thing is that she was explaining there's more nerve hookup and more vessels to be able to use in your arm than there is your leg. There's only about 1, I think, in your leg, so 1 vein and 1 nerve to be able to hook up. So the risk of not having as much sensation, having some complications in your from your ALT is higher than your arm. So between those two, it is your leg. But just depending on the person, the doctor, the experience, your health, all those things could be a big risk. And either surgery, you could have complications or you could have none. But when it comes down to it, on their side of things, the higher risk one would be with ALT. The follow-up care, as I mentioned, I do have 2 doctors here, so that's not really a problem. Everything is going to be covered if I do have to fly back to the clinic for any reason, or if I have to get something fixed. Complications, like I said, for revision, stuff like that. So the biggest thing I think I wanted to ask her was with the arm scarves. When you take the scarf your arm, that's at RFF, but it leaves you, not always, but it has left people with the indent. So then it kind of goes down, and then it kind of goes in more, and that was something I've seen and noticed. And I'm I know there's a way to kind of help this, which is by getting this, I don't know what it's called, but it basically, so once they take the graft off your arm, you are left with your bones, your ligaments, your veins, whatever. On top of that, they would put this, sort of, it's like a film or whatever. And then on top of that, they take the graft from your leg then to cover that. So what it does is just helps to kind of build a little bit more of a barrier in between your arm and the skin, so that also gives you a little bit of extra thickness, and that way, in the end, hopefully, you won't have that huge indent as much. And that was something I was worried about, and asked her, is this something you guys offer? And it is. It's just, it's not paid like through your province normally, at least. So it'd be have to be out of pocket, which is fine. I just don't know how much yet, but once I find out, I will let you guys know. But it is just good to know that they offer that, and it is something I'm definitely considering when I go in and I see her in person. I will talk to her about that. But it's just nice to know that they do offer it. So another question I had was with each surgery, I wasn't sure if one like was going to give you more girth and length than the other. With your leg, you are usually prone to more girth than your arm because there's just more skin or fat underneath the skin. Sorry, and with your arm, like just depending on the size, like even still, like I'm pretty small in both my legs and my arms, but you're almost guaranteed to have a little bit more girthy on the leg. So between the two, if you were to use the ALT graft, it would be probably more girthy. Excuse me, but between lengthwise, I was actually surprised, but for both, like if I wanted at least 7 inches, I would be able to guarantee with my arm and my leg. So either would work for at least that. If you wanted more than that, your leg would then have to be the option because they can only get so much because they only take between like pretty much where your elbow bends to your wrist. That's the maximum. So depending on the length of your arm would be that like or your forearm at least would be depending on the maximum size that they could get. I was just shocked that I guess they could take that much. I didn't think that. I don't know. I didn't think it was an option. I thought it was just going to be like a certain point, say like 5 inches or something would be the maximum. But no, like was kind of told by her that at least like even if I wanted 7, that would be an option. So that was kind of nice knowing I had a decision between both my arm and my leg as I wasn't really sure because of my size and everything. Like it made it a little bit more calming to know that it was an option. So I did ask to see if they had any photos, so I keep looking down here. But currently they, just for like reasons and confidentiality, they don't send photos over, email and stuff, which was fine. But, it would just be nice to be able to see a little bit more representation for her and her results. But I'm hoping to, like I said, to make an in-person consultation with her. And then from there, we'll hopefully just be able to see the pictures, which they said they do have, and just to know kind of like what her results look like and to kind of more so what to be expected. I was hoping to be able to like receive them through email, but they don't. So in order to actually see pictures, you would have to go for an in-person consultation. But they do offer them. It's just that's the only way that they would. So I think the last few things I want to touch on here was the biggest thing was another one was for my surgery. I know they offer implants, and this is something that I know a lot of people sometimes do or don't want. If I was to ever go with an implant, the biggest thing for me is I didn't want the pump. I've heard a lot of complications with it. It didn't seem like it suited me for like what I was looking for, I guess, in my future. The biggest thing I was looking at and I've seen is that it's called like a semi-rigid rod. And I wasn't sure on if this is something that they would cover. And she said that she actually has never had someone ask this question. But the two sites that are on their page that they recommend actually both offer it. And I mentioned that, and she's like, you know what, if it would be something that she would be willing to look into and be able to even use for me if that's something that we both are comfortable with. And that was amazing. I was happy to hear. I wasn't sure if she would be like, no, like I only stick with this implant, but nope, she was more than willing to consider it, which was really great. I'm really happy with that. That's an option for her because for me, it was kind of like, have the implant or not have one at all. And that I didn't feel like was an option, but I also didn't want the pump. And I felt like if I went with the pump, I wouldn't be as happy, as I would with the rod. So I'm going to keep you guys posted on that like throughout this journey, but it is something that is really good to know. And I'm really pleased that she's willing to do that. The next, and probably the final thing I'll touch on was my recovery time would be about 6 to 8 weeks, which isn't too bad as long as there isn't any major complications. And then as well, my wait time right now, like once I go in for my second consultation with her, could be 6 months minimum, which I think would be pretty quick because I got to still have electrolysis, which is removing the hair off my arms, which I think I'm going to try and do 2 times a week. Which is usually about hour sessions. If I can do longer, then I will. But I'm going to try and make as many appointments as I can, like just to kind of get it done as fast as possible. Because if I can get it surgery in 6 months, then I definitely would be willing to. But if I need to wait 8 months or 9 months, just because depending on your hair grows in different stages, so if I have to push it off a little bit more just because of the hair growth and trying to get it all cleared, then that's fine. I honestly expected it to be closer to about a year time before getting surgery, which then keeps giving me more time to save. But if I get it in 6 months, I will be fine. I just knowing that it could be any time between now, like once I get this consultation, which I'm not sure when yet, 6 months after that to about a year mark, I would hope maximum for myself to have surgery. It was just kind of like now this realization of like, wow, this is actually happening. It's coming along, and I'm super excited. But yeah, that's basically the gist of, I think, what I had to talk to her about. If you guys have any questions, maybe, when I do my in-person meeting with her, if you guys maybe think of something I didn't ask or want to know, then, put it in my comments. But this, I guess all of everything talking with her has kind of made me realized that the best option, and I said I didn't and wouldn't change my mind, but I did, and I'm going with RFF. And the main reasons for that is sensation-wise, the perks of, better and more, higher chance of better sensation, less chances of having complications, less stages, so which means less time off work, and just in general, knowing that I was able to have and be able to be okay with, everything that she had said, and just, knowing that's where her comfortability is for me, it made it seem like it was just the right decision for me, knowing I could also get that graft as well, to hopefully not be as indented with that, I can't remember the name of it, I'm really sorry, but with that thing to go underneath my graft to be able to help with that as well, if I ever wanted to go for tattooing, which I've eventually wanted a whole arm sleeve anyway, so I'm really not too worried. But the options for me, it just makes more sense with talking to her to have RFF, and I did not think I would be changing my mind. I honestly was thinking that the conversation with her, between the two, I didn't think there was going to be such a huge difference with the hookup and with blood flow and nerves and sensations and stuff. I didn't realize there was a huge difference. So for me, it definitely opened my mind and my eyes to what I wanted, what I needed, and what the best decision was. And RFF has now been that ultimate decision. So I hope you guys are okay with that, because that's what I'm moving forward with. I'm going to hopefully get a consultation date soon, go in and meet her, make sure everything is okay, and then I can use my arm, which will be hopefully my left arm. The biggest thing is this tattoo. I love this tattoo. I'm going to ask her to minimum, if she can, go below the leaf. If not, the highest I want it to go is right below here. So yeah, it would kind of cut into a little bit of this leaf, but that's fine. It actually would still work for the tattoo. I really wouldn't care too much, but because where my wrist bends, it bends right about here. So the tattoo is just a little bit lower than that bend, and I don't want my scar to be too high, so I don't want it to be too restricting where I bend my wrist anyways. So if they can drop it a little bit, which would mean I wouldn't have as much length, but I'm okay with that. If I then only have 6 inches to work with, that's fine. For me, that's not a huge deal. I'd rather not touch the tattoo if I can help it. But all in all, I am going forward with RFF, and I'll keep you guys posted on everything with that, and I'll take you on the journey with electrolysis, and hopefully on my consultation be able to record that as well. But anyways, if you guys have any more questions, comments, concerns, anything, you always comment them below, and I'll hopefully be posting in soon. Okay, bye for now.